Welcome back. There's a madman on the loose who's still claiming the so-called COVID vaccine is a life-saving intervention. And I bet masks and social distancing were necessary too, right? Let's take a look at this obviously orchestrated establishment shill roundtable.
It's astonishing to me that so many people, by political ideology, will make a decision that would actually endanger their lives. Because of people getting less vaccinated because you're a Republican versus a Democrat, there are more deaths and hospitalizations in red states versus blue states. That's horrible that happens, that people suffer and die because of misinformation that's related to a political ideology.
Talk about political theater. I have a hard time believing anyone is really falling for what is so obviously propaganda. Cardiologist and Chief Scientific Officer of the wellness company, Dr. Peter A. McCullough, MD, joins us now to discuss. Dr. McCullough, welcome back. Thank you so much for being with us. What do you make of Fauci claiming the COVID protocols of the state are scientifically proven life-saving interventions? I mean, hasn't this been thoroughly debunked at this point?
If you think about it, all the experts agree, including Fauci, that the vaccines only worked for a few months. And then boosters had to be taken. Hardly anybody even took a booster. So there was no way that the vaccines, even if they were efficacious, that they could have done anything. Vaccines are not a solution to a pandemic. There's no study that's assessed the survival of Republicans or Democrats in the hospital. All of that is basically fictitious media speak by Fauci, who's still propagating. No randomized trial has ever shown the vaccines reduce the risk of hospitalization and death. The vaccines did not reduce transmission of the illness. The early randomized trials showed a reduction in new cases of mild COVID that were basically immaterial. The consent form does not indicate the vaccines reduce the risk of hospitalization and death. So Fauci is completely wrong. This is not scientifically proven whatsoever. In fact, the vaccines in multiple analyses increase the risk of recurrent infection and have increased all-cause mortality.
So why do you think it is that these old talking points are now resurfacing if this is all untrue? I mean, there's obviously a lot of talk about the next pandemic being bird flu. In fact, former director of the CDC, Robert Redfield, predicts the next pandemic will be from the bird flu, while mortality from COVID was 0.6%. Robert Redfield says bird flu mortality is more likely to be somewhere between 25 and 50%. Do you think this is why these conversations about, COVID protocols are now resurfacing? And are these numbers actually accurate, or are they being overhyped like we saw during the beginning of COVID?
Redfield is working off of very old statistics from Southeast Asia, patients not getting care, high inoculum, far more virulent forms of bird flu. And, we've never had an American death due to bird flu. The current cases that we have in the United States have been a very mild conjunctivitis, no pulmonary involvement. Now, bird flu host range has now expanded, probably due to gain of function research by the U.S. Poultry Research Laboratory in Athens, Georgia, Dr. Carl Koa in University of Wisconsin, Dr. Ron Fouché at Erasmus. They all are working to increase the host range of the virus in their research. Calicoa and Fauci, supported by the Gates Foundation, they're trying to get it to spread human to human. But what we're seeing in animals right now is PCR test positive. The animals aren't particularly sick, and we're seeing no confirmation that they actually have animal fatal influenza pneumonia with the current strain.
Yeah, it really is amazing. And we know who is really in on this progression of this bioterrorism against we the people. And reportedly, the Gates Foundation awarded $9.5 million to the University of Wisconsin-Madison to make H5N1 bird flu transmissible to humans. I mean, this is extremely alarming. Dr. McCullough, can you tell us more about this, and why would anyone need to be doing this type of alleged research?
The stated goals, and these are in the papers by Caracoa as well as Dr. Ron Fouché, supported by Gates, but also supported by Fauci and the NIH, the stated goal is to create a human virus and then get ahead of it with bird flu human vaccines. This is dangerous, reckless, gain-of-function research. It should be banned and shut down all over the world. We should not allow Fauci or Gates to fund this type of research. It was a disaster in the creation of SARS-CoV-2, and they're trying to create a potential disaster with bird flu, but this is different because the mallard ducks, the migratory waterfowl, are carrying it all over the world, and through natural evolution, the virus is becoming much more mild. So I don't think Redfield is on track here. Remember, Redfield is the one who said that masks were going to be more effective than vaccines. Neither one of those handle pandemics. Nobody should be fooled. We don't need animal vaccination and we don't need human vaccination. Vaccines are not ways to handle pandemics. Natural immunity and then early treatment in humans is the way to go.
Absolutely. So if, these so-called vaccines or injections didn't work, like you just touched on, why is it that scientists are testing mRNA vaccines to protect cows and people against bird flu? I mean, what are your thoughts on this, and why are the warning signs being ignored here?
There's so much money in vaccines. Can you imagine, for instance, a human bird flu vaccine? European Commission has already committed to 40 million doses of the CSL Seqirus antigen-based vaccine, which is not even coded against the current 2344B strain. So it's against legacy strains, and it didn't work very well there. Now we hear that CEPI, funded by Gates Foundation, as well as CSL, they have self-replicating messenger RNA vaccines for humans. They're looking for big government pre-purchases so the biotechnology companies and their investors, like Gates Foundation and others, where they can receive a big payoff. This is all about massive money going into the biotech sector for bad vaccines.
It's such a nefarious agenda they have here, and it should really concern every single American citizen, because we know what their goal is, and it's absolutely frightening. But Dr. McCullough, we're so grateful for all of the incredible work that you've done to expose this. I want to ask, who do you believe is ultimately at the top of this pandemic industrial complex, if you will, and what is their end goal for humanity?
It's impossible to know, but I think we should take the words of Klaus Schwab, the former head of the World Economic Forum, in the Great Reset. Bill Gates, as he's, out there, head of the Gates Foundation, major driver behind CEPI, World Health Organization, other components of what we call the Bio-Pharmaceutical Complex. There is a general theme that there are too many people in the world, that too many people are consuming too much meat, and we need to move away from meat consumption, too much carbon dioxide and methane production, too much nitrogen production by the animals, and that somehow in a new world, a new world order, everything would change for the world ecology. And this type of groupthink is among the global elites, and it's permeating down through all these agencies. Unfortunately, disastrous decisions we've seen with farming in Europe, with now this global spread of bird flu, which looks like it is with human agency for sure, false positive PCR testing on farms by government agents. None of this is looking good. I don't think Americans are going to buy it.
Yeah, I sure hope not. I hope we learned from the last go round and we don't repeat the same mistakes. Dr. McCullough, we are all out of time for today. Thank you so much for all of your amazing work and your time and your insight today. I appreciate you.
Thank you.
For all our viewers asking where One America News is heading in the future, we would like to introduce you to OAN Live. OAN Live is the best way to stay up to date on all of the hard-hitting, straight-shooting, national and international headlines. And the best part is, OAN Live is only $4.99 per month. All the credible, honest, unbiased reporting One America News offers at a fraction of the cost of cable. Just go to OANN.com to easily sign up for OAN Live and stay informed.